The important thing here is that this is the first phase 3 results to be reported from a trial involving neoadjuvant chemo-immunotherapy. As you know, there's been a lot published in the last 3 or so years on both pathological outcomes, event-free survival outcomes, and surgical outcomes from various treatment regimens in the neoadjuvant window for operable lung cancer. And at least in the surgical community, there's been, I think, a lot of uncertainty as to what exactly the implications of neoadjuvant immunotherapy are for the thoracic surgeon, for the patient undergoing surgery. Is the operation more complicated? Do we have to do more of these cases via traditional open approaches? Can they be handled by a minimally invasive surgical approach? Are the postoperative outcomes equivalent to untreated patients or patients who have had traditional, conventional induction regimens, be it chemo or chemoradiotherapy? So I think that's where this study is so important, is that it's going to give us a little bit more, less biased view of what the real outcomes are. It's a multi-center study conducted in some 150 centers around the world. So it's also going to give us some external validity to a lot of the findings, because a lot of what's been published so far is, high volume academic centers who've done phase 2 trials, usually surgeons who are accustomed to complex scenarios and who are open to exploring these kinds of things. And now it's a much, much broader and diverse surgical cohort. So I think in that respect, these are extremely important results for the the community of surgeons, oncologists treating this kind of disease.